Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. This is your host, Samuel, and today I have with us a very special guest, and she goes by the name of Lauren Brown. Now, Lauren Brown is a medical device sales rep, but this is a fun episode because she's actually a medical device sales influencer. You can find her on _Lauren Brown with 3 N's on TikTok. She's also on Instagram and she's on LinkedIn, and she is quite the powerhouse full of amazing information for people that are in and want to be in the medical device sales industry. She specifically is in the aesthetics space, and today we have a fantastic episode where she educates us on what exactly aesthetic medical device sales is, how to be effective within it, and of course, how she, on a daily basis, influences people in the space. So, I'm excited. I'm not going to spoil it. I'm not going to give anything away. I'm going to save it all for the episode. Make sure you are tuned in, whatever it is you're doing. Take some time to take a listen to this episode. And as always, we do our best to bring you innovative guests that are doing things just a bit differently in the medical sales industry. And I really do hope you enjoy this interview. Hey, Lauren, how are we doing today?
Hi, I'm good. How are you?
I am fantastic. Why don't you tell the audience who you are and what you do?
Yeah, so I'm Lauren Brown. I am an ex-NFL cheerleader, a Michigan fan, and then also for my day job, I'm a medical aesthetic device salesperson or sales rep.
Wow. Okay, so we got a lot to talk about. And we're going to kick it off with the first thing you said, which is ex-NFL cheerleader. So, what is that like?
So I actually did it while I was in sales. And so it was like my side gig. Very hard, very hard. You have like 4-hour practices, 2 to 3 times a week, game days, very fun. So the energy of being on the field. I also danced at the University of Michigan. So it was just, it's my past life, but it's also a part of me.
That's beautiful. Now, was it high school you were a dancer the whole time and you just transitioned it to college? Or was that something you discovered in college?
No, I grew up. I was a professional dancer my entire life. I actually danced for some big names, and then so like Mariah Carey, Goo Goo Dolls, yeah. And then in college, I was on scholarship for dance.
Amazing. Do you still dance now?
I mean, I like try to do TikTok dances.
when doors are closed and no one's looking.
Yeah.
Okay, that's so cool. So now think back to being an NFL cheerleader. You were in sales, but you weren't in medical sales yet.
Medical sales, yeah.
Oh, you were in medical sales?
Mm-hmm.
Oh my gosh. Now, tell me you were using that to get access.
100%. I mean, that truly was such a, from like a branding perspective, I was like a company's dream because every doctor wanted to talk to me and they wanted access to the team. They wanted all of that information. So yeah, it really was, it was very strategic.
You got it. Okay, so I'm putting you on the spot now, but you got to give us a story. I mean, like, what was the most, how can I say it? What was the most profound experience that worked because you have this background to offer?
So I worked with a dermatologist, and this woman wanted to have access to all of the NFL players' wives. And she just like, I think most salespeople have a hard time getting a hold of doctors. This woman called me day and night, just constantly. And you don't hear that, like salespeople don't hear that. But yeah, so I still like see her all the time, and she's just super sweet. She never really got access to them, but she thought that like calling me all the time would. But
wow. Okay. Hey, whatever works. All right. So then, aesthetics, medical device sales. I want you to explain exactly what that is. I think a lot of people have their ideas on what it means to be an aesthetics device sales rep, but let's actually hear from one. Share with us, what does it mean to be an aesthetics device sales rep?
Yeah. So in my bag, I have three different types of products. In aesthetics, there's so many different sectors that you can really get into. So you have lasers and that type of energy modality. You have injectables, which is what I'm in. So there's different types of injectables that you can utilize in a practice. There's med tech, so things like aesthetic record, cherry, and then there's skincare. So being in my field and being in an injectable rep, it is it's a grind. It's hard. It's a really rewarding job. Seeing patients feel better or improved or like they're feel like themselves again is probably one of the most rewarding things that I've ever been a part of. So with aesthetics and injectables, we're looking at different types of anatomy on the face and trying to do facial balancing with different products. And there's a wide variety that you can choose from. So it's really helping them differentiate clinically what's going to give them the best endpoint.
So you mentioned the segments. You said there's lasers, there's injectables. Are there many other segments or just like one or two other segments?
I would say like two others. So skincare is a really big segment in aesthetics. And then also med tech. So that's kind of like an emerging side of med aesthetics. But yeah, like those are the main four, I would say.
What's med tech?
So there's different areas of med tech right now for aesthetics. Cherry is one of the largest that's growing right now. And that's a financing company for medical aesthetic practices. So it allows patients to be able to have higher cost treatments at a more affordable monthly rate. But there are other ones like Repeat MD, which is more of like a marketing tool for aesthetic practices. And then there's Aesthetic Record, which is like an EMR system for aesthetics just as a whole.
And there's sales reps for all of these products.
Mm-hmm.
Wow. Okay. And yours is the injectables. So
Yeah.
let's get a little bit more into the weeds. So you mentioned seeing a patient's gratification on, being able to change their face and showing up the way they want is one of your biggest joys. Are you actually working with patients, or is this just what providers are communicating to you when they utilize the injections that you represent?
So I actually see patients probably every day, just about. I do a lot of labs with clinics. So understanding, especially from a filler perspective, there's so many different gels on the market, and really understanding the different properties of each gel is important. It's like having different paints and paintbrushes in your toolbox.
Okay.
So having a variety of different patients is always such a fun thing to do with like my labs that I do. So we get to see patients their before, during, and then their post procedure.
Oh, wow. Okay. So,
Mm-hmm.
people are listening right now that really want to get into aesthetics, and this is complete news to them. Can you walk us through what this actually looks like? You start your day, you show up to an account, and then walk us through this whole scenario of the pre, post, and everything else that happens.
Yeah. So I typically like to do these. I plan them in advance. So typically 2 weeks in advance, I say get 3 models or 3 patients and have them have maybe some medial cheek deficiencies. Maybe they have some wrinkles that they're trying to relax, or maybe they're trying to balance out their rickets line. So the rickets line being their chin to their nose.
Okay.
And what we do is we try to look at full face correction on these patients. So the clinical endpoints are very different, and it's very subjective, which is different from OR sales or really any other medical device sale.
Right.
So that's the 2 weeks before. We pick out the products that we want to use, the patients, and then we have them sign their consents. We bring them in that day, schedule them out, and we do a full face assessment looking at where the deficiencies are, the different parts of aging, and how we can address them with the products that I have. And we just go through the entire process of injecting, looking at landmarks from an anatomical standpoint, and take them through the journey.
So wait a minute. So is the provider saying, hi, patient X, this is what's going to happen, and hold on one moment, I'm going to now introduce you to Lauren, who's going to explain something else?
Yeah, I'm like in the room the entire time usually, and they're like, the rep is here. She really we were looking for some good patients to trial this new product on. And it's really fun because it is a joint effort. It's not A lot of times, I think when I was in the OR, a lot of times you kind of feel like you're going to step on toes.
Sure.
And being in aesthetics, it's more of a joint. We're working together to get the best endpoint. So it is really fun to be just so intertwined with your providers.
Wow. So, okay. Now, with this kind of interaction with patients, I mean, are they calling you after, or is that
No,
okay? Okay,
no,
strictly off limits.
no.
Okay,
So that would be, I mean, it's like that's a violation.
got it.
But
Okay,
I mean, I don't know the patient information. I don't really know their history or anything like that. They're just there and they're the patient at the time.
sure.
But if the provider has questions afterwards, they always text me. And we just kind of walk through if there is anything like bruising, swelling, anything like that. We go through what's normal and what's abnormal.
Okay.
And yeah,
Okay. So I'm going to ask you for a story. I'm putting you on the spot again.
I love it.
You got to give us, give us the most, I don't know, moving story where you were like,
Moving.
wow,
Okay.
I get to do this. Oh my gosh. Like give us something.
So I had a training day and this patient couldn't afford to have a treatment done. And this was when I was working in Chicago at the same company that I'm currently at. And she came in and she kind of walked with her shoulders down. She walked in,
Yeah.
she had her hair in front of her face. She really was, I felt like hiding. And she sat down in the chair and we were going through an assessment. And whenever you're treating a patient, bedside manner and aesthetics is really important because we don't want to point out areas that we might find to need improvement if they don't feel like that's something that they notice, right? So we always try to ask, like, where are some areas that bother you, or what areas are you brought you in today, and to let them open up
Oh,
because that psychology of an aesthetic treatment is pivotal. So she came in and she was, I feel just tired and she had a few deaths in the family, like consistently was having all these things happen to her. And we did a bunch of treatments. It was a few $1,000s worth of treatments. And just all, we did it as an evaluation on her. And she cried in the room when we were done because she felt like herself again. And she, after she left and she gave us all hugs and just was, so appreciative, she went out into her car and she cried for another 20 minutes, came back in and was just like, I can't tell you guys how much I appreciate what you've done for me. And it's really knowing that this type of treatment can change somebody's trajectory of their day, of their week, of their life. And the way that you view yourself is more important than the way that anybody else views you. So that psychological piece of this medicine is just something that I've never seen in medicine before.
that is beautiful.
Mm-hmm.
So this was an immediate experience for, I mean, I'm sure not every
Mm-hmm.
treatment's like that, but for her specific
No.
case, this was an
Mm-hmm.
immediate fix.
And a lot of times, we have a few different products that some, take 2 days onset
Sure.
as a wrinkle relaxer, but fillers are immediate. So you're getting that immediate volumization or smoothing of lines. And then we also have another product that's a biostimulator, and that takes about 3 months
Oh,
for it to actually kick in. So you kind of have a breadth of different utilities to use. And if a patient's like, I've got to get this fixed today, you know what you can use.
wow. Okay. So a couple things I want to understand. I want to understand your previous experience that is now allows you to compare your current experience. But before we jump into that, give us a little bit about what type of person you need to be really effective at being specifically an aesthetics device rep. How do you need to present?
Yeah.
What type of qualities must you absolutely have if you're truly going to be successful?
I think for the first, and I don't think this is what most people are going to think, but being really assured in who you are personally and your brand and what you have to offer.
Okay.
The space can be very cutthroat and people can say some really mean things. So I think really being confident in who you are and what you have to offer and really standing firm in that is going to be the number one.
So let's
Um,
give that just a little bit. So that's number one. and please remember the others, but I want to give some more context to that. You know, what do you mean
Yeah.
by people can say some really mean things and you must be self-assured in who you are?
I mean, you can have doctors, if you walk in and you don't look your best that day, say, "Oh, you really need a treatment." Or, "Ooh, have you ever thought," I had a doctor say this to me, and I will never forget it. "You need nose filler because you have, your nose is too thick."
Wow.
And it's those, and I will say this is far and few between, but you will have them and they will stick with you.
Mm,
So I think it's just understanding that people don't have boundaries, and especially in this space because they can fix things.
right.
And they think that everybody that walks in the door is asking for an objective opinion of theirs. So that's where I'm coming from with being self-assured and who you are, and knowing that aesthetics is, it can make you feel really great, but you also have to know that it sometimes can make you feel really crappy.
Yeah, makes perfect sense. What are some of
Mm-hmm.
the others?
So I think second is being an entrepreneur or entrepreneur type mindset.
Yeah.
This job is not just, I'm going to sell somebody something. This job is a holistic approach towards getting a business to run efficiently with your products.
Mm,
Because the more efficient that the business runs in aesthetics, the more that you're going to sell organically. So if
mm,
you can start changing that mindset of, I'm selling you this, and more so looking at it from, this is going to generate your business X because I'm going to help you do all of these different areas and pull it through. That type of mindset shift is where I think a lot of people struggle from going in the device side into aesthetics.
So what you're saying then, and correct me if I'm just way off here, but it sounds like what you're saying is, you know, for device, for pharma, for most other medical sales, it's clinically driven. You're making the case for the clinical significance for that patient on whatever the disease state or
Mm-hmm.
injury or whatever have you needs to be addressed. But for
Mm-hmm.
aesthetics, I'm sure that's included, but you're more so talking about the value proposition by using your product line to do more for their business in just getting patients and keeping patients.
And I will say, yes, but clinical significance is also extremely important because you can lose a patient really quickly if you don't have the proper treatment and the proper products in place. So I will say it is a merging of both. The
Cool.
science of the art of selling science and also business is, it's extremely hard, but it's also a beautiful art form that you have to be willing to kind of like mold yourself into.
Man, the way you describe it, everybody listening right now is going to want to be an aesthetics medical device. Okay, let's get a little more into it. So with most medical sales,
Mm-hmm.
you know, if you're a good rep, you're gonna get so proficient with what you understand and be able to be so well and be able to communicate it so well that your provider is going to start to trust you for information to address his or her patients, right? In
Mm-hmm.
aesthetics, is that same dynamic created, or is it even more so? Because I'm assuming, and I don't know this, but I'm assuming with aesthetics, the technology is fast and changing and constant, more so than other disease states and other fields. So
Mm-hmm.
the providers in aesthetics, they're really relying on the sales rep to have the most up-to-date opportunities to help their patients. Is that true?
100%. And I think the difference, well, actually, I'm going to say this is a similarity from a device side, is knowing the marketplace and the landscape and knowing your competitors, what their clinicals are saying, and what does yours personally say, and really vetting through it. Because when you can bring more clinical significance to a provider and also be well versed on anatomy, and for injectables, the face is an extremely important part of the body to be addressing.
Absolutely.
And in all other areas of the body, you can put on clothes and cover it up. Your face is the first thing that people see. So really being able to talk through different landmarks and the anatomical points, and really understanding the market just as a whole and why things are better in different products might be better for certain
Sure.
scenarios. It is important, but that's also how you can sell into the business
Wow.
side of it.
Wow. When you describe it, I'm thinking with aesthetics as a sales rep, you can literally become the provider's best friend. I mean,
Mm-hmm.
you're allowing them to do more for their patients. You're allowing them to do more for their income.
Mm-hmm.
You're allowing them to do more for their staff. I mean, it's kind of an overarching way to help.
We are welcomed in, and I will say this, when I walk in versus like another rep walks in,
Right.
they're like,
Right.
Lauren, like they're so excited to see me. And I also, I'm not, I think another difference is every time I see a provider, I'm not just selling them something. I'm not just there to sell. I'm listening to how their business is going. What are their patients saying? Who's asking about different products? Like, what is going on in their business? And then, like, we also do get to connect on a personal level. And it is a little bit more relaxed. You're not in, an OR or like rushing to get a doctor from a break room or wherever you can find them in the hospital. So I do think that it's a nice marriage of like outside sales and medical.
Amazing. So, give us a little bit about the kind of experiences you had in other medical device fields
Mhm.
before you got into aesthetics.
So I started my career at Stryker. So I was there for just under 2 years. And I knew when I was there, I was like, aesthetics, aesthetics, aesthetics. And this was back in 2015. So I knew I wanted to get there. I just didn't know exactly how. So I started researching some of the aesthetics companies. And there was one that was hiring for a capital device
Okay.
position. So I moved into that position after Stryker and realized really quickly that I am not a capital sales girly, which is fine.
Right.
But it just, you have to experience it. And it did give me a lot of exposure to the aesthetic space.
Mhm.
So after that, I went into a consulting role for a marketing company for aesthetics. So I
Mhm.
really learned the back end and the business end of aesthetics, which
Mhm.
I think catapulted what I'm doing in the field now.
Right.
Um, little did I know that that's what that was doing then,
Right.
but now I use all of the tools that I've learned from that position
Wow.
to really help drive business in my practices now.
That's beautiful. So you said something
Mhm.
earlier that I want to touch back on. And I've heard this from other people that have been in aesthetics, and they have all referred to the aesthetics industry as very cutthroat. Now, providers poking jabs at you, trying to make you a patient is one thing. Other than that,
Mhm.
when you say cutthroat, give us some more context on what that's referring to.
So the aesthetic space, there is a lot that people can choose from. And if you're not the rep that's showing the most value and providing value outside of a price, you're going to lose. Like it is a lot of price driven wars that go on. Um, but if you're not the lowest priced product, really what you do to stand out is find other ways in their business and how that you're going to help them grow. So there's a lot of reps out there. It's a constantly, everybody's growing. Every week I see new territory expansions and new products on the market, things like that. So it really is if you don't have those relationships and you don't show your value, people will drop your product.
Got it. Got it. Okay. How long did it take you to understand that?
Thankfully, I mean, I feel like I understood that from the OR.
Okay.
Um, I had when I was at Stryker, I had devices fail and like things missteps that happened to my products.
Sure.
So I knew that like I needed to build that trust and also build that type of relationship that I'm going to do whatever it takes to make this right.
Got it.
Um, and so I think that really translated into my business now. But also, when people call me, I answer. When people text me, I answer. When they email me, I answer. And I'm punctual with things. So I think a way of changing that mindset of standing out is just being a responsive and punctual rep.
I love it. I love it. Got to appreciate that.
Yeah.
Okay, so as you guys listen to this aesthetics device rep and all the value she brings to her customers, what you might not know is what she does in the influencing space. But I'm not going to spoil it. I'm going to let you share this other thing.
So I started a TikTok maybe a year and a half ago. And really, it was to challenge one of my offices to post every day for 30 days.
Okay.
And basically it was a challenge like, if I get more followers than you, like I win this challenge.
Okay.
And I started just getting like an outpour of like people reaching out, and just like the support was there and people really wanted to hear what I had to say, which I don't think I was ready for.
Mhm.
Um, so I started just posting some of the topics that I wish I would have known when I was getting transitioning from a corporate job into a sales position in medical.
Wow. And
Mhm.
today?
And today, I mean, I'm still doing it.
Okay, so I'm gonna say it for you. I'm gonna say it for her. And today she has a whole following, a TikTok following, an Instagram
Yeah,
following that you guys can catch on and listen to her. And it's amazing. So many videos, so much information, and it's growing every single day by the thousands. How about that?
yeah.
That
I try to
accurate?
like not pimp myself out, but thank you for pimping me out.
No, you know what? I just think it's fascinating. And what I love about what you're doing is you're 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 sharing your current experience with people, right? This isn't something from the past. This is just as every day. And I think to bring people into your life every single day and show them what's really going on. I mean, how are you not to be trusted after that? It's an awesome thing.
Yeah. And I mean, I know we kind of talked it through like, what a day looks like, kind of like with the patient model calls and things like that. But that really does give a more realistic idea of my days. I
Sure.
mean, typically they start at 5:36
Okay.
and typically they don't end until 7:38. So, I mean, they are longer days, but that's to prioritize the things that I want in my day to make
Mhm.
sure I get them done.
Now, is that typically because you're just going from account to account? You know, in this account, you saw maybe one, two, three patients. In this account, the same
Yep.
thing, all the way until 7 or 8 o'clock at night.
Not every day do I see, do I do evaluations like that. I probably do them like 3 or 4 times a week.
Okay.
I did the other day, I did two in one day, it's a little bit more. But my territory currently is so large that I drive about 60% of the day. And so using that time effectively. So I use voice text a lot, voice email a lot. I
Right.
call a lot of people. So I try to utilize my time driving as best as I possibly can.
Got it. Got it. And for again, for people that are really interested in aesthetics, is it the kind of job that you're going to be working from 5 a.m. to 8, and you better get used to it if you want to be a quality aesthetics rep, or is that strictly by choice?
I can say that it's by choice, but it's not. So as much I try to put as much boundaries as I can. But again, I said this. I like to be punctual. I like to get back to people. I know when I need an answer, and especially if it's something important, I need an answer now, right? So when people reach out to me, I mean, I usually get calls, texts all weekend, because that's when businesses are open for aesthetic practices, and that's when they're seeing a lot of patients. And then, like time off is really not time off. And I know this is in a lot of sales positions, but truly, like in medical and in medical aesthetics, um, these businesses need this product, and you're the only avenue that they can get it.
Sure.
So you're a necessary part of their business.
Right.
So time off is really, you're still working. Just if I'm being completely transparent. Now, are there reps that don't work as much as I do? 100%. I just like to know my business inside and out. And I like to be prepared before I'm in front of somebody. I might not see someone, I might only get to see them twice in a quarter. So if I'm not prepared, I'm not doing my job properly.
Preaching. Do you hear that?
Yeah.
She's preaching. Okay, so then would you say that aesthetics, generally speaking, everybody's different, but generally speaking,
Mhm.
does not offer the best work-life balance?
I would say that this is my experience. Um, yes, I would
Sure.
say but not to say if you have a smaller territory and you might have it. This has been my experience. Um, and I don't mind it. That's the thing. I love what I do. So it's a lot of times it doesn't feel like work when I get to prepare for something like patient day or lab or anything like that. So um it's kind of like what if you're willing to put in the work and do the things like I'm explaining, the benefits are so rewarding. And you just get to help patients and practices out even more so. So it is a really rewarding job, even if you don't have the best balance.
Beautiful. And with aesthetics devices, is it base plus a commission? And if it
Mhm.
is it a small base with a huge commission, huge base with a huge commission, or a huge base with a small commission? What's the setup typically like? And what can someone that's thinking about taking this on as a career expect to make as far as a range?
Yeah, so I think most injectable, because I can actually speak on energy device and injectable because I've been on both sides.
Sure.
So we'll start with energy, and typically that's a little bit lower than an injectable base, but the earning potential is really high. So you're getting their bonus structures are based off of how much they're discounting each product, and so they could earn 10% of what they've sold. I don't know if you can hear my dog. He's playing with his toy. Sorry. Um, so they can earn 10% of what they sold, or they can earn 20 to 25% of what they sold, depending on how much they're discounting their product. So energy, I have a friend that makes 500 a year in energy. Again, it is a hustle that is like she is out hunting every day.
Sure.
That is a hunter job.
Sure.
Now, injectables is more of a farmer job. So I have an account list and I'm basically trying to grow them. My base or our bases in injectables is typically anywhere from about like 70 to 110, depending on your experience.
Okay.
And then going into commission, typically commission structures are pretty standard. Most companies are around like a $20,000 commission structure if you hit 100%. And then they have accelerators and all of these different things that you can make more.
Suppliers. Right.
Exactly.
Right.
So people in injectables can make 180,000, or I know reps that make close to 450.
Gotcha.
So it's really just kind of dependent. And again, the longer that you're in the position that you're in, this is going back to that work-life balance, the more you can kind of have that balance because you've established that business. So that's just something to note as well.
That is awesome. Wow. Okay, Lauren, we could talk forever. You have so much information to share with us. We're gonna get close to wrapping this up, but before we do, we're gonna have a lightning round. Are you
Okay.
ready?
Yes, I'm ready.
All right. I'm gonna ask you 4 questions. You have less than 10 seconds to answer. First question: what's the best book you've read in the last 6 months?
Ooh, oh my gosh, don't make me pick. 100,000 or 100 million leads by Alex Hormozy.
Ooh, that just
Mm-hmm.
sounds interesting.
Mm-hmm.
Yeah, I'm writing that down. 100,000 leads. Okay,
100 million
that's
leads.
good.
He has
100
another
million
one. It's
leads.
a
Okay.
he has 100 million leads, and then he has a new one out. I don't remember what the other one is. But Alex
Nice.
Hormozy, if you guys are in sales, I love his content.
Okay.
Very entrepreneurial mindset. I love him.
Love it. Okay. Best TV show or movie you've seen in the last 6 months?
Oh my God, I'm so lame. The Office, because I just can't stop watching it.
You better not say that's lame. That's my favorite show of all time.
Okay. Okay. I
Office
just
is the
constantly,
best show
it's
ever.
just on constant rotation.
That is nothing gets better than that show. So
No.
nothing lame about it. All right. And then the best meal you've had. And when I say this, think restaurant. The best meal you've had in the last 6 months.
Okay. So we are wedding tasting. Our wedding's in a month. And we
Congratulations.
had, thank you. We have a filet that we're having, and just it was literally the best filet at our tasting. So I'm gonna say that because I'm so excited to eat it at the wedding.
I mean, there's no source to go to get a taste of this tasting.
Oh, it's at the Shinola Hotel in
Wait,
Detroit.
in Detroit.
Yes.
Okay. All right.
So
Noted.
San Morello is like the restaurant.
Okay.
But yeah, it's a Michelin restaurant. It's so good.
Ooh, Michelin one too. Okay,
Hmm.
fantastic. And then lastly, what's the best experience you've had in the last 6 months?
You know what? I'm gonna go a year, and I'm
Okay.
just gonna go a year because this is like a new experience for me. My fiance, my mom, and his mom all went down to Rosemary Beach in Florida,
Yeah.
and it was probably one of the first times that I felt like I could decompress and actually breathe. And if you haven't been there, it's like this magical part of the Panhandle in Florida The
Okay.
beaches are so white. The water, it's just a calm area,
Wow.
and it's just really healing. And
What
I
is this
loved
called
it.
again? Say it one more time.
So it's 30A is like the area. Rosemary Beach and Seaside are like two of the main areas over there.
Okay.
Just a really like calm, healing vibe.
Wow. Sold. Sold.
Yeah,
Okay.
beautiful.
Well, Lauren, this was fantastic. It was lovely having you on the show today. Where can people find you?
So you can find me on TikTok, the underscore Lauren Brown with three N's. And then on TikTok, the Lauren Brown as well. On both of my Instagram and TikTok, there's an email if you want to email me. And then LinkedIn, you can find me Lauren Brown. I know that's a really generic name. I look the same in the photo, so just like find this.
Fantastic. Lauren, thank you so much for being on the show. We can't wait to see all the amazing things you're going out there and doing.
Thank you.
And that was Lauren Brown. Make sure you follow her. Go to the underscore Lauren Brown, three N's at the end, and follow her. She's on TikTok. She's on Instagram. As I said before, and as you've heard, she's packed with so much information. It's fun. It's exciting. She literally brings you into her world. You got to go. So some of you might be listening to this episode and thinking to yourselves, that's where I want to be. I want to be in aesthetics, medical device sales. I want to live the Lauren life. Well, you don't have to wonder. You don't have to guess. You don't have to hope. You can actually do something about it. And you already know what I'm going to say. Visit evolveyoursuccess.com. Look into the Medical Sales Career Builder program. Select apply. Give us some information. And let's have a call with one of our account executives. And let's get you into the position that you deserve to be in. We know how to make sure that this is the right field for you if you want it. We know how to help you find the right field for you if you know you want to be in healthcare sales. We know what you need on your resume. We know how to build these things for you, for your career portfolio, for your presentations in the interview. We know how to connect you to the right people that will have a say in the hiring process. We know how to do all these things, and we're here to help. So again, if you want this, if you want to be in this space, if you want to be in this industry and you want it sooner than later, then visit evolveyoursuccess.com. And of course, keep listening to the Medical Sales Podcast and make sure you tune in next week for another episode. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.